Hi, everyone. Jeff Gianola, and I know a lot of you watched my story, Journey Out of Silence, about my hearing loss and how I was isolated and often frustrated, and hearing aids were no longer working for me. And this last February, I got a cochlear implant. Here it is right here. And if you watched my story, someone that appeared in my story was an audiologist named Lindsey Hill. And I want you to meet Lindsey right now. And Lindsey, it's so good to see you right here. And first of all, Lindsey, explain what an audiologist is, a clinical audiologist.
Sure. So a clinical audiologist is a provider who does diagnostic testing to identify conditions relating to the ear, hearing, vestibular issues, as well as performs rehabilitation such as fitting hearing aids or working with cochlear implants to help people.
And in my case, I met you about 7 years ago when I started to lose my hearing. I had something called Meniere's disease. Now, there's a lot of reasons people lose their hearing, and maybe you can go over that. But in my case, it was Meniere's disease. So let's start with my particular case, and let's talk about others who live. What is Meniere's disease?
So Meniere's disease has to do with the fluid imbalance in the inner ear. And there's basically attacks where people may have vertigo or extreme dizziness.
That's what I had.
Yeah.
It's pretty bad.
Yeah, I remember you having a hard time driving and all the things. They can also have big fluctuations in hearing, especially in the low bass tones, and then like a whooshing or a roaring type of tinnitus. And there's different types of treatment options to try to help it, but sometimes, regardless, the Meniere's disease wreaks havoc on hearing and can cause a significant amount of permanent hearing loss.
And that's what eventually happened to me. Now, over the years, I saw you would do hearing tests with me, and then, I would fail those tests. And I got to tell you, it's pretty frustrating. At what point was I a candidate for a cochlear implant?
I think that you were probably a candidate for a cochlear implant well before you moved to actually looking into candidacy and having the surgery and everything. Basically, there's some strict criteria that insurance looks at, and that's FDA approved for cochlear implant candidacy. But the basic answer we give is when hearing aids aren't cutting it, when even with well-fit amplification, the hearing aids are just not able to provide that peripheral access to sound in the specific ear. The cochlear implant's a good option to evaluate for and to see if we're able to move forward.
So I guess the big question would be, folks will say, well, what's the difference between a hearing aid and a cochlear implant?
Yeah, well, if you think about it simply, the hearing aid is making sound louder. It's making sound louder in a very controlled way based off of your specific hearing loss. It's not just amplifying, it's intelligently amplifying.
Yeah, and I wear a hearing aid in my left ear, but I'll probably have to get a cochlear implant eventually.
Maybe sooner or later.
And then now I'll pull out the cochlear implant. What's the difference there?
Yeah, so the hearing aid is using the same hearing system, the outer, middle, inner ear, to pass the sound through. The cochlear implant is an electrode array that's placed down in the inner ear. And it's using electrical stimulation to basically bypass all the damage and stimulate the nerve more directly.
And when I put this on, it magnetically attaches to what they implanted inside right behind my ear. And that allows me through that speaker to directly stimulate my auditory nerve. You know, what's weird, Lindsey, and I don't think people quite get this. I don't hear through my ear anymore, through my ear canal. I literally hear through a speaker up here. And that's kind of weird, isn't it, in a way?
It's different. It's hard to wrap their heads around.
Yeah.
We don't need an ear at all, really. We don't need the outer ear, at least, the ear canal or the pinna. It's just picking up the sound. We're using the outer ear, as a microphone holder. And it's picking up the sound and processing it, and then wirelessly sending it through the skin to that internal receiver, and then continuing on.
In my case, I think you activated in mid-March for the first time, you activated my cochlear implant. And I got to tell you, that is the weirdest sound that you hear. I mean, you told me how it would sound, but what's amazing, what I can't believe is since then how each week it seems like my brain is adapting and remembering, and it's starting to decode those sounds, and I'm starting to hear more normally, I guess you would say. Is that what happens?
I tell people it's like a 6-month journey from when they get the cochlear implant turned on to when they say, this is normal, this is natural sounding. Because I agree. I mean, it's using maybe 24 electrodes trying to replicate several thousand hair cells and frequency points. It sounds vastly different. And the more you wear it and the more you expose yourself to sound, your brain's really smart at figuring out those connections and making it sound more and more normal.
Yeah, now talk about in my case, it was Meniere's disease that basically, really, if you think about it, what Meniere's disease did was destroy my inner ear and actually my sense of balance. It's hard for me to balance these days, but I lost my hearing. You see lots of people with hearing loss over the years. What are some of the other common forms of hearing loss besides Meniere's disease?
I mean, some people were just born with hearing loss. So they were born, it's called congenital hearing loss, where they, for various reasons, didn't have anything to begin with. And cochlear implants can work for that depending on what's causing the hearing loss. If they don't have an auditory nerve, certainly they can't have a cochlear implant, but otherwise they can be really successful. Noise exposure, we see patients with a history of excessive noise, and they may be a good candidate. People who have various ototoxic hearing loss, meaning different medications or chemotherapy can impact it. People may have hearing loss caused by growths on the hearing nerve, or different types of syndromes can cause hearing loss as people age. There's a lot of different causes, and some of them we can point to and say this is caused by XYZ, and sometimes it's just a mix of genetics and luck and circumstance. And a lot of people can benefit from cochlear implants. A lot of people can benefit from hearing aids, and it is a requirement that they try hearing aids first and see, is it that a hearing aid is just needing to be programmed better for them, and that will allow them to benefit and to flourish without needing a cochlear.
Let's talk about vanity, because I have to tell you, I have so many people coming up to me now, and they say, Jeff, do you have your cochlear implant on? And my thing is, I just want to hear. The big moment with me is when I couldn't hear my grandkids anymore, even when they were whispering in my ear, and it just broke my heart. And I said, I got to get that cochlear implant. But this issue of vanity, I run into more people that say, well, I don't want to wear that hearing aid. Yeah, my doctor says I need a hearing aid, but I don't want to wear it. And then a cochlear implant, which is much more visible than a hearing aid because you have this device that, sticks to the side of your head, the speaker so you can hear. How do you get through that wall of people, that vanity wall, when people say, I just don't? What do you tell them?
I think that it is definitely a personal decision, right? And if someone's going to not wear a cochlear implant because of the size of it or how it looks, that is a choice that they will make.
Yeah.
You could make the argument that it is much more obvious if you are withdrawing from social environments, if you are unable to communicate or mishearing things. I would say that's more obvious than having something on our ears. I also personally think, even though I'm an audiologist and I love ears and I look at people's ears all day, I don't look at people's ears when I'm talking to them. I look at their face, I look at their eyes, I look at their mouth. And a lot of times people will tell me they'll get a hearing device, whether it be a cochlear or a hearing aid, and they won't tell their friends or family. And then they'll wait to see how long does it take before someone notices. And sometimes it's a really long time. Now, a cochlear is a surgery, they're going to notice, but hearing aids especially, you can be pretty discreet. And if you have longer hair, or even your hair, I feel like it's not very obvious at all. I wouldn't know that you were wearing it unless you pointed it out to me.
I have to tell you, and I've talked to a lot of people with hearing loss, how isolated you feel. I mean, for the last few years, any family function, work functions here in the newsroom, I couldn't hear. And so I'm not going to go to that meeting, or, I'm kind of embarrassed because I couldn't hear it. Now, the coworkers were wonderful when I would ask to repeat something and, can you tell me? But I got to tell you, I never expected to feel that isolated or alone, especially around family and friends, and confusion sometimes when I didn't know what was going on. My wife, what a saint for these past few. I heard, what did you say? What? And I heard someone say that sometimes hearing loss can be the silent killer of relationships. I mean, that's really sad, isn't it?
Yeah, I mean, I think that the social isolation involved with hearing loss and how people may withdraw and choose not to go to social events or not to go on vacations or go out to eat because they don't want to put themselves in those situations. I mean, forgetting about the correlation with isolation and aging, right, and cognition, but also, yeah, it is so isolating, and that's why I'm in the field, is because I want people to be present and to open up and to be connected. I had one of my earlier patients, he was in all the appointments. It was back when I wasn't in Portland, and his family was talking, and it was almost implied that he was, you know, had cognitive impairment, that he was just sitting in the corner, that his memory was failing, and he got a cochlear implant, and he just woke up. His personality was back, and he could be present, and he could communicate, and that's why audiologists do what we do, is to allow people to be back with their connections and back with their family.
For people like me, older, who lost their hearing, me due to Meniere's disease, my doctor, my regular doctor, told me when he knew that you were seeing me, and Dr. Warren, the ENT who's treated me, he's wonderful over the years, but he reminded me that, hearing loss doesn't exactly help you when it comes to dementia. It could actually, it can actually be something that accelerates dementia. And I can see why after hearing loss. I mean, isn't that true?
So I don't know that I could say that dementia is caused by hearing loss, but I can say if you don't hear it, you can't store the information.
Exactly.
Yeah. If you're not able to be, if your brain is working so hard just to get the information barely enough to be able to respond, our brain, our processing ability stops, and we don't store it. We don't have that long-term memory storage.
A lot of folks watching this are going to go, okay, I've been struggling with hearing loss. What should they do? They don't know anything about audiologists, or do they need to go to a doctor first? Kind of walk us through the steps. If someone watching this right now is saying, I think I might need hearing aids. Forget about the cochlear implant. I mean, for right now, I just might need hearing aids, or I know I need hearing aids. How do I go about that? What would you tell them?
I would recommend getting an evaluation. Most insurances will cover a hearing test, and so you can find out what your hearing is and then find out what options are appropriate. Sometimes it's as easy as there's wax in the ears, and then they can get cleaned out, and then that can make things better. Sometimes it's something that needs to be medically treated, and then we would recommend seeing someone like Dr. Warren or another ear, nose, and throat physician to help with it. And sometimes the answer is hearing aids, which will hopefully help bridge that gap and get people more access to sound. And then possibly for some individuals, eventually, cochlear implants.
So is the first step, if you think you're listening, to see an audiologist, or is it to see an ENT doctor? How does that work?
I would generally recommend an audiologist. It's going to be easier to get into an audiologist, and an ear, nose, and throat physician likely is overkill, I would say, for most people.
Okay.
And then if they have hearing issues, medical issues, then the audiologist should be making that appropriate referral, to get them in to see somebody so that they can get that treated.
And a lot of ENT doctors work very closely with audiologists, right?
Absolutely.
Yeah. So we're kind of running out of time here, Lindsey, but our final thoughts on this. People think, okay, I've been missing life. I want that. What would be your final words of encouragement to someone who said, I've been missing out on life because I can't hear and I'm a little bit afraid? I think a lot of times people are afraid to find out the diagnosis is, yeah, you can't hear and you need hearing aids. I mean, what would be your words of encouragement to them?
Well, I would say generally by the time they're thinking that, it's probably time to at least get the evaluation. There's the amount of people who could benefit from cochlear implants is massive. There's no age cutoff, both in terms of the minimum to the maximum age. And even if I help a 96-year-old patient for just a few years to be able to communicate with their family, that is so important. It's so important to maintain communication and connection with our friends and family, and whether that's through hearing aids or cochlear implants, it's vital that we get the information so that you can make a good decision, an educated decision on how to best help yourself.
Well, Lindsey, I personally want to thank you over the years for guiding me through this journey, because you know it can be pretty discouraging, and you've been there every step of the way, and you've really helped me in my journey out of silence, and I really, really appreciate your time. And hopefully this little discussion that we had here, as well as my story, Journey Out of Silence, will help folks who are struggling with hearing loss. So thank you very much.
Of course, I'm glad to help.